She ate a handful of unwashed raspberries, not from a street vendor, not from a foreign market, from a paper bag on her own kitchen counter. Organic, local, the kind she bought every Saturday from the farmer's market 3 blocks from her apartment. She rinsed them most days. That morning she was running late. She did not rinse them. 6 days later, Emma Schulz was in a cardiology unit in Portland, Oregon. Her heart was beating in a pattern no one could explain. The rhythm was wrong. Not fast, not slow, wrong. Like something was interfering with the signal from the inside. The cardiologist ordered an MRI. What it showed was still moving. This is system failure.
At Oregon Health and Science University, the clinical team faced an absolute diagnostic dead end. Emma Schulz was 27, a Portland graphic designer with no history of cardiac illness, no chronic conditions, and no genetic predispositions. Yet she lay in the intensive care unit as her heart actively failed. Her electrocardiogram did not show a standard block or a typical arrhythmia. It captured a chaotic, disorganized flutter, as if an external force was interrupting the electrical signal. Her troponin levels, signaling active muscle destruction, continued to climb. The cardiologist ran autoimmune panels, toxicological screens, and standard viral PCR tests. Every single test returned negative. On paper, her young heart was perfectly healthy. In reality, she was dying. This is system failure. Emma Schulz was 27. A graphic designer in Portland, she lived alone with a rescue cat she adopted 2 years earlier. She was careful, organized, and health-conscious. She prepared her breakfast with routine precision. She always washed her fruit. She cleaned the litter tray every 3 days. But Toxoplasma Gondii oocysts are stubbornly durable. They survive on dry surfaces for months, waiting. After she handled the tray, the microscopic parasite clung to her skin. From her hands, it transferred directly to the fresh raspberries she ate for breakfast. A single, unseen contact. The cat was an ordinary household presence, not a villain. But nobody had ever told her. There was no warning on the packaging, no warning on the cat food. Remember the cat. Remember who never told her. Toxoplasma gondii is a single-celled parasite. It is incredibly common. An estimated 40 million Americans carry it inside their bodies right now. Most of them will never know. In a healthy host, the parasite remains dormant, locked away in muscle tissue and brain cells, silent, inactive, contained. But that containment is a fragile truce. When the immune system is weakened by stress, exhaustion, or another ongoing fight, the parasite reactivates. It wakes up. For 10 days before she ate those raspberries, Emma had been battling a relentless respiratory infection. Her body was tired. Her defenses were depleted, worn down by a constant daily struggle. She was no longer a secure host. She was vulnerable. When the oocysts entered her system, they did not face a fortress. They found a body already compromised, its defenses stretched thin. The parasite was free to act, and it was still moving. Day 1. A dull, persistent headache. Emma treats it with 2 paracetamol and continues her work. Day 2. An overwhelming, leaden fatigue. She falls asleep at her desk, her body struggling against an invisible invader. Day 3. A sharp tightness behind the sternum, heavy pressure. She schedules an appointment with her general practitioner. By this point, the parasite is already invading her cardiac muscle. It is nesting. Day 4. The general practitioner listens to her chest and hears an irregular rhythm. He orders a standard electrocardiogram. It reveals a minor conduction abnormality. The general practitioner suspects work-related anxiety and refers her to cardiology. Stress is assumed. The doctor does not ask about her rescue cat. He does not ask about her litter tray or the raspberries she ate for breakfast. The standard cardiology referral form does not contain a single question made about animal exposure. The system missed it. The parasite was still moving. Day 6. 3 a.m. Emma woke to a terrifying hammering lurch in her chest. Her heart was racing out of control. Desperate, she called an ambulance. At Oregon Health and Science University, her vitals were failing. The emergency electrocardiogram captured a chaotic ventricular arrhythmia. Her blood work arrived with severe warning flags. Troponin was highly elevated, indicating active muscle destruction. Her white blood cell count was high. Eosinophils were raised. The clinical team drew a logical conclusion: a healthy young woman with a recent respiratory infection. It made sense. The initial diagnosis was viral myocarditis. It was plausible, logical, and standard, but it was wrong. Emma was now fully inside the hospital system. She lay in the intensive care unit, her life hanging by a thread. The parasite was still moving, and nobody was looking for it. Inside the cardiac muscle, the parasite claims its territory. Toxoplasma gondii invades the individual cells of the heart, transforming them into hosts for bradyzoid cysts. Each microscopic cyst holds hundreds of slow-replicating parasites packed together, waiting. As long as they remain enclosed, they are hidden. But the truce is temporary. When immune pressure shifts, the cyst ruptures. Hundreds of parasites spill directly into the surrounding myocardial tissue. The body responds with a wave of intense, localized inflammation. This swelling does not just damage the muscle. It physically blocks the delicate electrical pathways that coordinate the heartbeat. The electrical signal misfires. The rhythm breaks. This is Toxoplasma myocarditis. It is rare, and it is easily mistaken for standard viral myocarditis. But viral treatments do not work here. Rest and anti-inflammatories do not stop the parasite. It continues to divide, entirely untouched by standard care. In documented cases, this silent, unchecked invasion has caused sudden cardiac arrest in young, healthy patients. Day 2. An infectious disease consultant reviewed Emma's chart. He noticed the elevated eosinophils, an unexplained spike completely ignored by the cardiac team. He entered her room and asked, did she have a cat? Did she clean the litter tray herself? Did she eat anything unwashed afterward? And then, Emma remembered. The litter tray at dawn, the fresh raspberries 30 minutes later. The consultant ordered a Toxoplasma serology test. The results returned strongly positive for active infection. For 2 days, the hospital had treated the wrong disease. The parasite was still moving, but now they knew its name. One question unlocked everything. The treatment began immediately. Pyrimethamine and sulfadiazine combined with corticosteroids to suppress the fierce inflammation. It was a race against a closing window. By day 4 of treatment, her troponin levels fell. By day 7, her arrhythmia stabilized. By day 14, her cardiac MRI showed the swelling in the heart wall was receding. Discharge came after 3 weeks. But Emma is not entirely free. She faced 6 months of medication and cardiac monitoring every 3 months for 2 years. The doctors were clear. Another 72 hours without the correct drugs, and the electrical scarring would have been irreversible. Her heart permanently broken. There is no routine screening for Toxoplasma in the United States outside of pregnancy. General practitioners and cardiologists do not ask about cats or raw produce. The intake forms remain blank. This is system failure. Health systems must add exposure prompts to standard triage, lowering the threshold for serology. Until then, you must protect yourself. Wash your hands after handling litter. Scrub all produce, even organic. If you experience chest tightness or fatigue after a respiratory illness, tell your doctor, I need to rule out Toxoplasma myocarditis. Check my eosinophils. This is system failure. Tomorrow, another young heart will falter because we forgot to ask. Remember the cat. Remember who never told her the parasite is still moving, and it's been hidden in a single missed rinse. Tell them, check my eosinophils. Join the conversation below.